Yes, today, Monday, is a great day.
What's up, guys? Hope everybody had a wonderful weekend.
I hope so. And I hope you're all sleeped up and ready for this, because today we're going to talk about a topic that I know will touch and affect everybody.
We get questions about this all the time. All the time.
It is probably the biggest question that we get is, does my insurance cover that?
Yep.
Will my insurance cover it? What's my insurance going to pay? What am I going to pay after insurance? Why don't you take insurance? I had somebody say, if you took insurance, you would see a lot more people. Yeah, but I wouldn't be able to help more people.
Right.
Just because I can see more people doesn't mean I can help more people. You understand? Well, what does he mean? My insurance. Insurance is healthcare. Bull crap, guys. You understand? Insurance is sick care.
Yep.
You understand? Healthcare is sick care. Doctor is disease management care. They just want to take care of whatever disease you have. How can I shut this patient up as quickly as possible so that they can move on and we get them the drugs that they need and they can wait and come back when they need more?
Yep. I mean, guys, literally when you go to your doctor, that medical card, that insurance card determines your care. And regardless of what your doctor thinks you need or wants you to do, what tests he wants you to run, what medications he would like you to have, regardless of, do you react better to the name brand or the generic, none of that matters. None of that matters. You go, you give him your insurance card, it determines how often that doctor can see you, what tests that doctor can run on you, what medications he can prescribe. So guys, that insurance card doesn't give a rat about your overall health. That insurance company doesn't care about your overall health. Insurance companies are there to make money, and they make a lot of money. And it's because of how the system's set up. Guys, your insurance companies, the pharmaceutical companies, and the medical world, they all work together for one primary goal: to make money, not to be healthy.
No, to get you well.
No, guys, we're the sickest country in the world by far, the sickest country. But yet, we're mandated to get all these insurances. When Obama came through, you have to get insurance. I haven't had health insurance in my whole adult life, so I got to pay a fee every year because I don't have insurance. We don't need to go down that route because we're not going to talk about that right now. But the biggest pet peeve: why don't you take my insurance?
Yeah, it's crazy, guys. And when really, you're asking the wrong questions, right? Because the question is, can I afford it? Number one, but that's not the question. The question is, do you value it?
Exactly. I mean, guys,
people drive 4 hours today just to come see us.
Yep.
4 hours, right? And we people drive from north, south, east, west. We people drive all over the place to come see this office because we don't take your insurance. Because I can tell you what you need. I can tell you what it's going to take to get you well. I can tell you what to do. I don't have to listen to what your darn insurance company, because I signed a contract that says I have to give you this and only this at that time. You understand? You want results, you got to do something about it. You got to do something different.
Yep.
And so yeah, we get people drive. So don't tell me that you live 20 minutes across town and you can't make it over here. You're not sick enough. Let me know when you're sick enough, though. Because when you're sick enough, you'll drive 4 hours to get there. Yep. You'll drive for a day. You'll fly. I had somebody from another country that wants to fly here and spend a couple days to get all the testing and things done that they can't do in their country.
Yep.
Do you understand that they're sicker than you are? Because if you're complaining about that, like my insurance doesn't cover it and it's too far, again, I just gotta say you're not sick enough.
Right.
Because if you were, you'd do whatever it took. And if you want to do whatever it takes, then let's make it happen.
Well, when it comes down to it, guys, I mean, our treatment in this office is yes, it's individualized, and depending on what your need is going to be your cost. But I mean, it's what we do is very, very affordable. We're not charging tens of thousands of dollars, to get you well. We make everything very, very affordable because, again, guys, we don't do what we do for money. Yes, we got to pay our bills, and yes, we got to keep our lights on, but we do what we do because we have a huge passion for changing people's lives, and that's why people are driving different states. People are wanting to fly from out of the country because of the clinical results that we get, and there's no way in hell we'd be able to get those type of results if we did what your insurance company allowed us to do. And it all starts with testing. I mean, that's one of the big things. And guys, listen, I mean, there's some tests that insurance companies will help with, but they say that most of our testing is not medically necessary. Because again, we're testing looking for the cause of disease, and your medical doctors are testing to just track and manage your disease. And guys, the testing is dramatically different. The treatment's dramatically different. If you're healthy, you're worth nothing. If you're dead, you're worth nothing. So they want to keep you right here in the middle, right? They don't want to cure anything. They don't want to test to look for cause of disease, right? They want to just manage your disease process, keep you on the medications. And guys, that is not healthcare, that's sick care. So if you're happy with where you're at, you're happy with the medications that you're taking, the results you're getting, continue to use your medical card, and that's all those are the results that you have to look forward to for the rest of your life. In order to get results, in order to get true health, you can't depend on your insurance company, because again, they pay for sick care, disease management care.
Yeah, I mean, health is not in a card, health is not in a pill, health is not in a scalpel, you understand? Health is inside of you, and insurance doesn't take care of that, and they don't take that into consideration. So, and listen, like I said, does insurance cover some of the testing that we do? Sure, they can help with some of the blood work that we do. Do they cover food allergy tests? No, it's not medically necessary.
Right.
It's not medically necessary to find out what is triggering your immune system each and every time that you eat it, which is making you sick, because there's a drug that can fix that.
Yep.
Do they cover the stool testing that we do? Yeah, but they cover my stool test. Yeah, but they cover a stool test to find out if you have cancer and why you're bleeding rectally, maybe. That's it. And listen, thank God that answer is no and it's negative, Yep. But if you want to find out why, you got to pay for it. Again, we don't charge much for those tests. And then the next question is going to be, because I know somebody's going to say, is well, how much do you charge?
Right.
Guys, it's individual. I don't know. Well, how much is one treatment? Well, listen, if you did one treatment, you think that's going to change your life? We don't do it in just one treatment. Right. It takes time, it takes effort, it takes energy, it takes work. And if you're not willing to work, then I promise you this is probably not the right thing for you. If you want the quick fix, keep on that road that you're on right now, because you keep searching for it, you're never going to find it. But when you're ready for change, you're sick enough. You're sick enough to make a 20-minute drive, a 40-minute drive, a 4-hour drive, fly a different country. Then you need to start finding, that person. And if it's not us, that's fine. But you got to find a wellness way doctor, somebody close to you, somebody that can give you a different way and a different approach. Go back and watch the Fireman Carpenter. Go back and watch the Swiss watch stuff that we did. Go back and watch our different views and our thoughts and why you should come see us. Because I'm just telling you right now, if you're sick and you want to get better, there's nobody better that can help you than we can right now.
And guys, it's what, just like Doc said earlier, it's what you value. Everybody finds money for what they want, and a lot of times they don't find money for what they need. Literally, you can pay for your complete program in this office by stop going to Starbucks every morning. That's it. $5 every morning times 30. That's $150 a month you're spending on Starbucks. Time and time again, we get people, they can get well with less than $150 payments a month. So guys, it's finding value in what you want. If a $5 coffee every morning from Starbucks is more important than you, then spending time with your kids, seeing them grow up and get married and having grandkids, that's a priority issue right there. 100% of the time, people come in here that want to get well, we make the money work, 100% of the time. Yep. If we need to discount it to make it work for people that have fixed incomes, come on, we do what we need to do to get people well.
We actually have a nonprofit that we have just started that we can now help more people in different ways.
Yep.
So like I said, there is a way if there's a will, but we don't help those people that are I want the quick fix, I want the next pill, I don't really want to make all the changes, but I'll make a couple of them. We're not going to do that. Right. We don't accept everybody into care. There's a lot of times where we just have to say, listen, this is probably not right for you or me. And I don't want to waste your time, nor do I want to waste my time, because I think time is the most valuable thing that there is.
Yep.
More than money, time is the most valuable, because time you can't get back, right? Time you can't buy more of. So guys, it's just time to understand, does my insurance cover some of the tests that we need you to do? No. Does your insurance cover you to get care in here? Chiropractic care? I was almost going to say absolutely. But that's not also true, because, listen, insurance covers less and less and less, and you have higher and higher deductibles anyways. You're paying out of pocket one way or another. Do you want to pay for sick care? Do you want to pay for true health care? It's your choice. Everything is your choice. You being sick is also your choice.
And understand this, guys, 80% of bankruptcy caused from medical bills, 80% of the time, you're fully insured. Fully insured, and 80%, and you're still going into bankruptcy because of medical expenses. So guys, and the same statistic, 80% of all medical expenses is diagnostic testing. So, these insurance companies are making so much money off of running you through tests, and at the end of the day, what do you normally hear? You're fine. Everything's normal. I know, but doc, I'm having all these symptoms. I know, but your tests say you're fine. Right? And so, I just had a guy in here the other day, and we talked about getting him going, and he goes, man, I spent this amount of money at one trip to the emergency room. Is what he's spending the entire time in this office for 6-8 months. He spent it one night in the ER, ran every test under the sun, Oh, everything's normal. Go home. Take an aspirin. Start taking an aspirin. And literally, the guy spent thousands of dollars and he's fully insured. It was just crazy. He had a high deductible plan. So again, guys, it's insurance for sick care. If you truly want to get healthy, you're gonna have to come out of your pocket. But the thing is, guys, it's a lot cheaper to stay healthy than it is to get sick. Very much so.
Your decision. You have to make better decisions. I talk about my 5-year-old all the time. It's like, you gotta learn to make better decisions, dude. And you gotta start making better decisions when it comes to your health, because it's not just you, it's your family that's affected. You understand? You affect everybody by the decisions that you make. But I gotta eat that sugar. You got to eat that sugar, or you want to eat that sugar. There's differences, you understand? And you make the decision and you let the sugar win, therefore you're choosing sickness, you're choosing disease. Guys, it's your choice. But again, you're like neuropathy. Everybody wants to say like, well, how much is neuropathy treatment? I don't know, it depends how much you need. It also depends if we can even freaking help you. How about that?
Yep.
Because maybe your cause is from, diabetes. Reverse your diabetes, get some sugars and some blood flow and some other things, we can make a difference. Maybe your cause is from chemo and cancers and things. And we might not be able to fix you, but maybe we can help you with some symptoms. Or maybe it's just something that we just can't help at all. I don't know. That's the point of an exam. That's the point of doing the testing to find out the proper testing. But again, unfortunately, your insurance does not cover the proper testing. If it did, why would we wouldn't be as sick as we are. You understand that, right? If insurance covered the proper testing, the proper supplements, the proper care, we would not be as sick as we are. Yet we get sicker and sicker every darn day. Yep. Because we're letting the insurance companies dictate healthcare. Come on, I'm telling the truth. Somebody tell me that you understand and you agree. Not talking about money, not talking about like costs. Do you agree that your insurance covers healthcare? Yes or no?
And just think about it. Think about the people that are fully insured. They go to the doctor all the time. Are they healthy? No. Like, you're stuck in that system. It's one medication after another. It's chasing symptoms. And once you get stuck in that cycle, because there's so many negative side effects to drugs, it's not going to stop, guys. It's not going to stop. So continue to use your insurance card. Continue to go down that rabbit hole. And that's why the statistics of heart disease and cancer and all these things are just off the chart. It's not going to change unless you get out of that paradigm.
Time to get out. Time to change, guys. I hope that makes sense. Insurance does not cover health care. Insurance covers sick care, disease management care.
Yep.
And if you're ready for change, then you freaking step out. Get uncomfortable. Do something different. But don't keep doing the same damn thing and complain about the same damn thing because you're doing the same. That's insanity. You understand that?
Yep.
Insurance, healthcare, it's insanity right now. And that's why we're different. And somebody was in here telling me today, it's like, I had a phone call with them actually, and it's like, I see the value in what you guys do. It's gonna be people like you, talking about us, that like people are gonna be searching out because they know that the medical system is broken. They know that they have to do something else. They know they have to pay out of pocket. They know they have to do something different to get well. Like, I just think it's amazing what you guys are doing, and I can't wait to start working with you. People are understanding it. This is a 23-year-old kid saying that to me. You understand? Like he knows there's no hope for him. Keep going down the road of the medical insurance route. There's no hope. And that's what it's all about. Who wants hope? Would you like some hope? Because if you want hope, and hope is simply defined as the definition of tomorrow is going to be better than today.
Yep.
The problem is when you leave your doctor's office, when you get off the phone with your insurance company, tomorrow is not better than today. Because now you're getting another organ removed and you're on more drugs, you're sicker, you're more tired, and you feel awful, and now you're scared because you think like all these surgeries and things are gonna cost you a ton of money. Well, they are. And they're also gonna they're gonna cost you time, which remember, time is more valuable than money. And if you lose time and you miss vacations and you miss soccer games and you miss school outings and things because you're sick, those are things that you can never get back. So just make better choices, make better decisions, put better things in your mouth. Exercise, get off your butt and move, right? Ask questions, get involved on this channel. Ask questions, we offer answers and give you advice on here. Like, it's just amazing what we're doing, and this doesn't cost you anything. And no, your insurance doesn't cover this Facebook.
That's right. I was gonna say, most importantly, the whole point of this, guys, is to know what insurance is for. Yeah. And if you're there thinking insurance is to keep you healthy, you're completely wrong. You have insurance just in case you get in a car accident and you have life-threatening injuries.
Thank God for it.
You come down with cancer. Now, Well, I guess that's probably not a good route either. That's a bad example because the last thing I would do is do chemotherapy and radiation, but another story. But guys, know what your insurance is good for, know what it's not good for. In order to be healthy, you got to step outside that box, guys. So,
yeah. Okay. So, yes. Appreciate you guys watching. Ask questions, please. We appreciate you guys. We thank you, but please make sure that you share this around.
Yep.
Please make sure that you like this, and please make sure that you comment, and we'll talk to you soon.
See you guys.